And welcome back to the show. During the height of the COVID-19 pandemic, New York-Presbyterian increased vaccine distribution among Black and Hispanic individuals in Upper Manhattan through targeted community outreach. Now, this effort led to more than 100,000 people being vaccinated. Joining us now and sharing more details is the Associate Medical Director at New York-Presbyterian Herman Denny Farrell Jr. Community Health Center, and also the Assistant Professor of Columbia University, Bagelos College of Physicians and Surgeons, Dr. Daniela Diaz. And Dr. Diaz, good to have you.
Thank you. Good to be here.
100,000 people, that's a good number. Talk to us about how you got there.
It sure is. It was a large effort through the entire enterprise of New York-Presbyterian. We really wanted this to be a priority. Vaccines had just come out, and we knew how important it was to improving the trajectory of the COVID-19 pandemic. So we really put all of the resources of the hospital that we could behind this effort to make sure we could vaccinate as many people as possible, particularly in our communities.
And when we talk about our communities, we know that in communities of color, they were the largest hit in New York City and across the nation. And sometimes, well, when I go back into history, initially a lot of people didn't recognize how damaging this virus was and how fatal this virus was. But then the urgency became for awareness, for letting people know, for getting out there and making sure that people not only got tested, but were also able to get the vaccination. What steps did you take in order to really make this come about?
Yeah, so you're absolutely right. The severity of the disease was not initially recognized. And then with time, we saw it was much more devastating than expected, but, maybe not surprisingly, because this often happens in healthcare, even more devastating to communities of color than to other communities who were, also very much affected. So we knew how important vaccinations were, but also knew that we needed to particularly target those people who were struggling the most or being affected the most by the disease. So we put together two interventions that we found to be the most useful in helping reach communities near where our hospital is, communities, Hispanic and Black communities in particular. I can tell a little bit about those major two interventions. And the first was to prioritize access to appointments for people who live in our target zip codes, who are groups that often don't have as much access to care. So making sure that that those people really did have the access to get the appointments for vaccines if they wanted them. The second part you mentioned, there was a lot of issues around hesitancy. So we quickly saw that access was not enough. There's a lot of misinformation. There's a lot of distrust of healthcare in general. So the second part that we really needed to focus on was education and comfort and combating misinformation, which is so prevalent now. So the way we found that was extremely effective in getting people vaccinated, or particularly people of color vaccinated, was to work with already existing community organizations. So faith-based organizations, other community NGOs, et cetera, they already have connections with community members and they already have trust with community members. So really being able to reach in a more targeted way people from people that they are already familiar with was extremely successful.
Yeah, you led into my question about awareness, because a lot of people did have vaccine hesitancy, particularly in communities of color. How much was it of a benefit to have persons who look like, sound like, to be able to convey that message to those in communities of color to get them in for both testing and vaccination?
I mean, it's really invaluable. You'll see that people we found that the most convincing part to patients, we present science and data and combat misinformation. But the big question people have is, did you get vaccinated? And so particularly me as a woman of color, that will speak to, okay, someone like me was vaccinated. Okay, I feel more comfortable. And not only me, they don't know me, but particularly, did my neighbors get vaccinated? Did my family members get vaccinated? So really having people who you identify with feeling comfortable getting the vaccine, seeing that they were okay after they got the vaccine, was one of the key motivators for many people.
And we talk about the Latino community. Many people were having to deal with the whole language barrier issue. How did you deal with the language barrier issue, getting that word out to a community that is definitely in need, but at the same time, still trying to navigate, really some tough waters?
Yeah, that's a great question. And, luckily for us, one of our major, we have several hospitals within the enterprise. One of them is in the heart of Washington Heights. So working with a largely Spanish speaking population is something that we are very familiar with. So we knew from before we opened, all of our materials needed to be translated in English and Spanish. We had vaccinators, providers, myself, who are fluent in Spanish, who can, help patients navigate the system. But we saw that we needed to kind of increase those efforts. So while, during the time that the site was open, we added full-time, several in-person translators, as well as virtual translators for languages that we are less commonly seeing, but still, need to be able to help people, because we can't provide healthcare if you can't understand what you're getting. So it is an extremely key part to make sure that you can communicate with patients in a language they understand and in a way that they understand.
You gave me a little bit of my next question, but you're talking about some statistics here. 12% of appointments that you had made through community outreach were Black patients, and then also 58% of appointments were through Hispanic patients as well. This is a great number. I think it needs to be replicated across, that we would have been able to see more and more people be able to take advantage. What would be the quote unquote secret sauce, if you will, to be able to see more people in communities of color to get them across the finish line?
Yeah, so it's about finding the communities where these patients exist, really knowing where you're going to target your efforts. Because, when things go out to all of New York City, you're going to get a mixed population that reflects all of New York City. But if you really want to focus on Hispanic patients, Black patients, you want to focus on areas where those populations make up a higher proportion of the people who live there. And then trying to understand the communities. What are the faith-based organizations that they go to? What are the community, the strong agencies that have ties to the community, and work with them to get hyper local and really focused on the people you are trying to reach.
And for you, looking back, if you had to do some things over, is there something that sticks out of your mind? Maybe we could do something a little different?
It was challenging. I think what was difficult was that all of the science and all of the data was moving so quickly. I think that, I wish that we had the capacity to create correct information with the same catchiness that misinformation spreads. And, I think as a hospital, we have a wonderful, PR department and all of that, but people who spread misinformation just have such a knack for making it stick. You tell someone that a vaccine is going to make them infertile, that is something they will never forget, no matter how wrong it is. And there's, I can say there's tons of evidence saying that that's not true. There's no evidence to support that, but it's just not quite as catchy. And so I wish that we could have identified, or that we can, even going forward, identify how to make real information stick and as appealing and as eye-catching as misinformation. I think that would have really gone a long way.
Yeah, it certainly created a more uphill battle for you, but I know that the truth be told, you were able to still get to the top of the mountain. Dr. Daniela Diaz, thank you so much for being with us, and congratulations on the great work that you did. All righty. We want our viewers to know if you want more information, don't hesitate. Visit the website at nyp.org. Then follow them also on social media, Instagram and Twitter at NYP Hospital. We got more show. Don't go anywhere. Open is continuing right after this.